Hello, everybody. Good morning. Good morning and welcome to the Colorado Health Institute's Hot Issues in Health webinar series. It is 8 o'clock on the button, on the dot, on the nose, all of the above. But we are going to get started in just a minute. We've got people coming in out of the waiting room and logging in. So now is your last chance. You have about 30 seconds. If you can quickly reach over to find a cup of coffee or get yourself settled, we are going to start in just about a minute or less. You have joined CHI's Hot Issues in Health webinar series. I'm going to do a slow launch here, but we have so much good content to share with you today. Two wonderful speakers, in addition to my being joined by my colleague, CHI's Director of Communications, Joe Hannell. So let's get started because we got a lot to talk about. Good morning again. I'm Sarah Schmidt. I'm the President and CEO of the Colorado Health Institute. And after a summer August hiatus, we are back at it for our Hot Issues in Health webinar series, and excited to have all of you with us today and for the next couple of webinars that we are hosting this fall. As people are coming in, as you know, we always like to do a little kickoff, and I know it is technically not fall yet. That's this weekend, I think, but if you live in Colorado, or really if you were just alive, fall is amazing in so many ways. And so perhaps get warmed up today by dropping into the chat and sharing with everyone what is your favorite thing about fall in Colorado or wherever it is that you are joining us from. So let's share some good fall tips, and we'll be excited to see what everyone is sharing while we're getting ready. Just a little housekeeping. We are recording today's session. We will also be posting it on our website when we're finished up. Also, you have the option to turn on captioning, so you can do that at the bottom of your screen. And we will have time for questions at the end. So either hang on to your questions or go ahead and drop that in the Q&A. You can also put those in the chat, and we will be monitoring them when we get ready. And there's some great stuff coming into the chat, things like leaves and colors and hot coffee and farmers markets and football and is it the weekend yet? No. Anyway, let's click to the next slide if we can. If you are just joining CHI, or if you're not familiar with the Colorado Health Institute, we strengthen communities and systems with trusted data and collaborative solutions to improve health. We've been doing that since 2002. And really since our founding over 20 years ago, Colorado has looked to CHI for independent, nonpartisan data, research, and analysis. We have prided ourselves on filling this role and working in a nonpartisan way. That means that here at CHI, we do not endorse nor advocate for candidates, for ballot measures, or bills. We also take pride in elevating voices from around the community, around the state, and around the country, and bringing those conversations to Colorado. We are excited to have guest speakers with us today who we have asked to talk with all of us about the elections and the role that that plays in the public's health. I will just flag as a caveat that, as with all of our guest speakers who join our webinar series, their opinions are their own. If we could click to the next slide, just a sneak preview, a couple of sneak previews coming up here. So we have two webinar series that we're kicking off today with a series of events that are really centered around this fall's election. So we're talking today about the link between democracy and public health, and also the public's health, and excited to engage in that conversation with all of you today. Next month, we invite you back here, 8 a.m., for a webinar about recent U.S. Supreme Court decisions and how they may affect health and environmental regulations here in Colorado. So taking that federal national view, and then what does that mean for us here in Colorado? Again, excited for that dialogue. And of course, we have the elections coming up in November, on November 5th. Hope everyone is ready for voting, whenever you get that ballot, and drop that ballot back off here in Colorado. Which brings me to a big announcement before we start our webinar for today. Pleased to excited to announce our annual Hot Issues in Health Conference is returning this year. Everyone, please save the date. It will be Thursday, December 5th. And we have some changes in store for you this year. We will be kicking off again in the 8 o'clock hour. If you're on this webinar, you are all about having early mornings. So we will be starting in the morning and wrapping up at about 11:45. So we are hosting a half-day event for Hot Issues in Health this year. As you can see on the screen, I am excited to share that we are partnering with the Colorado School of Public Health, and the conference will take place on the Anschutz Medical Campus here in the Metro Denver area. We will have a live stream option, though, for our partners who can't make it into Metro Denver for Hot Issues in Health. This new half-day format is exciting. It's really getting us back to the basics, though. We are devoting that half-day to conversations with key thinkers in health policy, sharing some analysis of the policy and the political landscape that will be impacting our state coming out of the federal and state elections. And as always, our perennially popular legislative preview. Tickets will go on sale on October 1st. We will have an early bird rate of $100. There will be more information on our website, and I believe my colleagues have already put some stuff in the chat already for you, so stay tuned. And please join us this fall for the webinar, and then join us on December 5th for a conversation. So with that, I am going to turn the floor over to Joe. Thank you so much for being here this morning, and make sure to get out and enjoy fall wherever you are joining us from. Thanks. Hey everybody, I think this is Sarah again, just jumping in. I'm guessing that we're still working out a little bit of the audio detail. So
we are. Sorry
there
about
we
that.
go.
All right. Are we catching my audio?
We are. Thanks, Joe.
All right. Thank you. So I am Joe Hannell. I am Communications Director here at CHI, and I've been here for more than 10 years now. I also work on our legislative team, which kind of brings me to the topic of this webinar. We have two great guest speakers today. Nora Maz is from Partnerships Director at Healthy Democracy, Healthy People. That's a national organization that is all about using increasing democratic participation in order to further public health goals. And then we have Andrea Wilkins, Legislative Liaison from the League of Women Voters of Colorado, here to talk about democratic access in Colorado. So we'll have a national and local view here. There we go. And now you can see me as well. I'm going to get us started with a little bit of scene setting, why we're talking about democracy and health, why a public health institute is talking about voting, and a little bit of evidence about why this really is a thing. So you might wonder, yeah, why is there, why are we talking about this? Well, in public health circles, this has really gotten to be a major topic of discussion. It's in the Healthy People 2030 federal health goals. It's official policy of the American Public Health Association that public health people should be looking to expand voting. And there's a rich set of data here that we have that ranges from around the world to down here in the United States. And I'm going to give us a little bit of a grounding in that right now. You'll see this world map here. It is what we're set on right now is life expectancy by country. And the darker the purple, the higher the life expectancy. You'll notice the United States is not quite the darkest there. And the brighter the gold, that's the countries with the lowest life expectancy. So we can kind of go and see 77 years in the US, almost 83 in Canada, pushing 85 in Australia. Russia, the about 70 years of life expectancy. And then we can toggle over to what's called this Liberal Democracy Index. This is a set of hundreds of measures put together by a group called Varieties of Democracy. They're out of Sweden. It's an international group though, and they rate all the countries based on the quality of their democracies. So again, dark purple, highly democratic country, the brighter the gold, less democracy. And you see big patterns here. You see the, Western Europe as in North America, the Pacific Rim countries are, broadly the Western Alliance. Those are the ones with the highest democratic ratings. And also a lot of the best health. But it's to convince you that it's not exactly, this isn't just measuring the rich European countries. There are a number of countries that do better than the US on both ratings that are not in that club. I'm thinking about Costa Rica, Chile, Uruguay, as well as the Pacific Asian countries of South Korea, Japan. What I'll show you now is this same data on a scatter plot. And this chart shows three things. The higher you get up on the bubble, the higher the life expectancy. The farther toward me on the x-axis, the more liberal and open a democracy. And then the size of the bubble is the population. This was put together by Our World in Data using that Varieties of Democracy Index, as well as UN life expectancy data. And we'll just kind of go through and show how the world goes here. We've got the least democratic on the side, then we start to get into South Asian, Southeast Asian countries, getting into South America and Africa here, and then the more democratic and longer life countries over here. You'll see US, Germany there. One big outlier, I believe, is China, very much non-democratic, but still quite a long life expectancy. You'll notice most of the world's population is over on this side, and for the most part, down below 70 years. Next is just that same graph with a trend line. So you can see the United States was right squarely on that trend line. And you'll also notice with the United States, we are below our peer countries in both democracy, or quality of democracy, and life expectancy. So that's the world scene. Keep that in mind as we zoom into the United States. Now, this is a map of voting turnout in the last presidential election. And it's showing the voting eligible population. Not every adult is over 18 is eligible to vote. So University of Florida has developed this voting eligible population metric. You'll probably see a lot of this in the next couple of months because, well, here in Colorado, we're in a race with a couple of other states, namely First place state is Minnesota. In the 2020 presidential election, 4 in 5 Minnesotans turned out to vote. Second place was Colorado. We were just so slightly below and kind of in the same league with Oregon, Washington. The only battleground state on that list is Wisconsin. And then the states with the lowest turnout, kind of in this swath from Oklahoma to West Virginia, as well as right in the Pacific, Hawaii. I'm gonna see if I can bring up chat here. Is there anybody, any state that anybody would like to see here? Just throw it in the chat if you'd like. Texas. All right, let's check out Texas. Texas is 46 out of the 50 states and District of Columbia. Only 3 in 5 Texans who were eligible to vote showed up to vote in 2020. Oh, Florida. Yeah, let's look at Florida. Florida's a little bit higher, about 70%. Michigan, why did anybody care about Michigan? It's not like it's been in the news now. Big battleground state, 73%. California, yeah, kind of middling, about 68, 69%. All right, thanks for playing along. This is going to kind of set up what Nora will talk about. The varieties of democracy within the United States. And then to zoom in one last time, let's look at Colorado. This is Colorado votes in the 2022 gubernatorial election by percentage of the voting age population. We didn't do the fancy voting eligible population here. But a couple of things strike me about this map. First, well, first of all, darker shades are more voters. Pretty intuitive. Lighter shades are where fewer people showed up to vote. So a few things strike me is that there's a lot of light shades on here, and also that there's a lot of variety. So I'll just go through and look at a few. Weld County, big Front Range County, 50% turnout. Right next door in Larimer County, quite a bit more than that. The highest turnout counties are these counties in the Southwest, mountain counties with, just a few hundred people in population. So, San Juan County here, everybody in the county lives in one town. The metro counties sure could stand to improve their voting, their voting turnout, if you ask me. With that, all that groundwork, I'm going to turn it over now to Nora, and she can. I'm going to stop sharing my screen, and Nora can take it away with what healthy democracy, healthy people is all about.
It would help to unmute. Hi, everyone. My name is Nora Moss. I'm the Partnerships Director at Healthy Democracy, Healthy People. And thank you so much to the Colorado Health Institute for having this really critical conversation today. So before I get started in talking about the relationship between health and voting and some of the work that Healthy Democracy, Healthy People has been working on over the last few years, I just want to remind everybody on this call that health is always on the ballot. From the ballot measures that we may vote on that have to do with funding for parks, transportation, education, or healthcare access, to the elected officials that we vote to represent us in every single system of government. And so health, whether it's healthcare access, pandemic response, maternal and infant health, reproductive health, or any of the social determinants of health, it is always, always, always on the ballot. So just so that we're grounded in a shared definition of public health, we use the the definition from the Institute of Medicine that public health is what we do collectively to assure the conditions in which all people can be healthy. And Healthy Democracy, Healthy People is a nonpartisan or coalition dedicated to building our collective power to realize health and racial equity by strengthening democracy through inclusive civic and voter participation. We are a coalition of 11 national public health organizations that was formed in 2020. As the novel coronavirus was picking up speed and the election was in our sights in 2020, our public health organizations came together and wanted to be sure that the message we were sharing with our communities was aspirational and encouraging, that we shared timely information about the rules and ways that people could vote safely and the options people had, but that we weren't showing up and just saying, simply wear a mask, wash your hands, and if you're at risk, think twice about going. Since then, we've done a lot to organize together and come together as public health and health professionals to really share this critical relationship between healthy communities and an inclusive representative democracy, and also promote nonpartisan civic and voter participation across our sector and the communities that we serve. So we see health and democracy as interdependent, and we know this because higher civic and voter participation leads to a greater power to influence the policies that impact our health. And having those policies speak to the community's needs lead to better health outcomes, which then reinforces higher civic and voter participation. And so it's a continuous feedback loop. We also know that the opposite is true, where we have less civic and voter participation, oftentimes due to barriers put up to keep folks from participating. We have less power to influence the policies and worse health outcomes. So how is democracy related to health? And Joe shared a little bit of the data highlighting this relationship, but I want to go a little bit deeper. So to think about this in a framework context, we have political decisions that are being made simultaneously about health, about the way that we interact in our communities, and about how we vote. Those political decisions determine communities that have more influence and power. And those communities have opportunity and better health because of that influence and power. And more civic and voter participation, which then leads to this reinforcing feedback loop that we call representation in those political decisions. And so then those political decisions represent the needs and concerns of the communities with influence and power. But we also know the opposite is true, that political decisions are made that disenfranchise or suppress influence and power of certain communities, which leads to lower opportunities for communities leads to worse health and less civic and voter participation, which then breaks this representation feedback loop. And I want to be really clear here that these are intentional political decisions that disempower communities and reinforce inequities. And so this is how I think about the relationship between democracy and health. And I think the research reinforces that. So we have a few examples from history where wherever we've expanded the electorate and the electoral power of our communities, health has improved. For example, when women's suffrage passed, we saw investments in infant and maternal health resources, and we actually saw child mortality rates decline. With the civil rights movement, we saw massive organizing, and we saw an ushering of more inclusive policies in education, housing, economic opportunity, and healthcare, including the establishment of Medicare and Medicaid. And the 1965 Voting Rights Act actually has been shown recently to be associated with reductions in Black infant deaths in the southern counties subject to one of the pre-clearance clause in the policy. And on this slide and in this table, all of these steps are steps forward. But let's make no mistake, each of these steps was contested, and there is a continuous struggle for community power. And so in 2021, Healthy Democracy, Healthy People started to think about, how do we tell this story about the relationship between health and democracy so that more people can be inspired to take action to protect and promote an inclusive representative democracy? In 2021, when we were reviewing literature on the relationship, we found two kind of common trends. One, that most of the literature was international, like some of the research that Joe shared today with the Liberal Democracy Index and the different countries where they stand on life expectancy. And the rest of the research was historical. And so we wanted to look at a contemporary example at the United States. And so we compared 12 state level public health indicators to the restrictiveness or ease of voting in each state. And what we found was really clear. States with more voting access and greater civic participation have better health outcomes. And I'm going to show that on this graph. So if you're looking at this graph, each of the boxes, depending on how small they look, represent a state. And I have starred Colorado, and you can see Colorado is kind of in that top right quadrant with more voting access and better health. On the x-axis, we have voting access, which is measured by the cost of voting index. And on the y-axis or up and down axis, we have better health to worse health. And you can see a really clear linear relationship where the states with more inclusive voting policies have greater levels of civic participation and are healthier. And we've seen additional research come out showing this consistent relationship between civic and voter participation, policies that make it easier to vote, and health outcomes. So states where it's easier to vote have better rates of state level self-reported health across a 25-year time span, lower uninsured rates, lower pre-vaccine COVID case and mortality rates, and studies show that civic engagement, including voting among young people and adolescents, is positively associated with better future income, education levels, and mental health compared to non-voters in that same age group. And I want to be really clear here that the voter suppression tactics that are used disproportionately impact Black, Latino, American Indian, young, and low-income voters. So those voters are more likely to experience longer polling lines, have fewer polling places per capita, be disproportionately burdened by stringent voter IDs, and specifically Black voters are more likely to be flagged for removal from voter rolls. These same communities are most impacted by health inequities. So what can we do in public health? Well, we believe in engaging in systems change at every single level. At the organizational level, we can do things like adopt policies to change the narrative and context for advocacy, like the Society for Public Health Education, the American Medical Association, and the American Public Health Association have all passed such policies back in 2022, and more have followed since. We can engage in state and local level systems change by joining efforts to promote state and local policies, expanding voting access, and incorporating measures of civic participation into our health goal setting. And at the national level, we can promote voter registration and participation using our administrative levers like healthcare.gov, Healthy People 2030, and county health rankings and roadmaps. And I'm really excited to announce that yesterday, CMS made an announcement that they will be integrating voter registration information into their healthcare.gov platform and insurance application. But you may be thinking that that feels a little bit overwhelming to engage in systems change in that way. So we have created a campaign with Civic Health Alliance, Vote ER, and us, Healthy Democracy, Healthy People, called Thrive Through Civic Health, We Will Vote, which is all about making sure that the health sector shows up and participates in every election we're eligible to this year. You may be asking, why are we organizing the health sector? Well, the health sector is 14% of all workers in the United States, about 22 million workers, which only accounts for health care. So some of us in public health may not be fully represented in that count. And we have a lot of power on the table. In 2020, out of the general population, a third of US eligible voters did not cast a ballot, and more than half of eligible voters in 2022 didn't vote. What's even more surprising and concerning is that healthcare workers, including physicians, nurses, physician's assistants, and dentists, are 12 to 23% less likely to vote than the general population. And so we have a real opportunity to organize ourselves, invite our friends, colleagues, and community to commit to voting this year. So we've done just that. We've invited organizations in the health sector to make a commitment to promote nonpartisan civic and voter participation across their memberships, employees, and affiliates. We launched in February, and we currently have over 70 organizations representing a wide breadth of the health sector all across the country and over 130,000 health professionals. And we're also inviting individual health professionals to join the initiative by pledging to vote and taking this pledge by saying, the health of my community hinges on the health of our democracy. Robust civic and voter participation is required to advance health and racial equity. I understand that the first step starts with me, so I join my colleagues and institutions across the health sector. I will vote in upcoming elections, encourage friends and family and or colleagues to vote in upcoming elections, work with We Will Vote to and my professional organization to make the organizational commitment, and or support elections through volunteer roles in my local community. So I want to invite everyone to join the We Will Vote initiative this year and pledge to vote, because we know when people pledge to vote, they're much more likely to actually vote. And health professionals are incredibly busy. So it allows us to share reminders and key election deadlines with you so you have a plan to vote and are vote ready come election day. So now I'm going to hand it back to Joe.
All right, thanks. And I will just simply toss it over to Andrea to give the local view, and then I think we should still have some time for Q&A. So get those questions ready.
All right, thank you, Joe. I'm going to share my screen, and I'm also working with two screens. So do a quick test to make sure that I've got you all on the right one. Okay, hopefully everyone has seen the slide view and not my nose. Looks good. Okay. Perfect. Well, as Joe mentioned, I'm Andrea Wilkins. I'm the legislative liaison with the League of Women Voters of Colorado. For those of you who are not familiar with the League, we are a long-standing organization. We were born out of the women's suffrage movement, and really kind of based on the idea that once women had fought and won the right to vote, we needed to educate ourselves. An educated voter is really key to our democracy. And so the League was born to provide voter education and outreach on a whole host of issues, ranging from social policy issues, environmental issues, natural resources, that sort of thing. And then, of course, a variety of government focused functions and voting in elections. Our goal overall is that we envision a democracy where every person has the desire, the right, the knowledge, and the confidence to participate. We are a nonpartisan organization. We encourage informed and active participation in government, and we strive to influence public policy through education and advocacy. That education piece is certainly going to be a theme of some of my remarks today, in terms of what we can really do to ensure that we continue to strive towards the healthiest democracy we can possibly have. So thinking a little bit about the elements of a healthy democracy, there's several factors that go into this, largely centering around trust and inclusion. For government to be seen as legitimate, people have to be confident that our systems and our public institutions can function efficiently and actually meet the needs of the people that it serves. Strong democracies are also empowered by engaged citizens. We need to ensure that policymakers understand the concerns and priorities of the population. And it really comes down to, that inclusive concept, inclusivity. Government is best equipped to provide for the public good when its actions are guided by a broad and diverse group of people. And then, of course, foundational to all of this is the equal opportunity to be heard. Our vote really is our voice, and we need to ensure that all people have meaningful opportunities to engage in the political process so that we have an accountable system of government that works for the people. So in terms of our public institutions, we expect them to be capable of providing for the public good and to meet our basic needs. Things that are essential to a well-functioning society, such as protecting the health and safety of the population and providing a quality public education system. If our institutions are inaccessible or ineffective, citizens lose confidence in the government's ability to respond to the needs of people, and as a result, democracy ultimately is weakened. Much as democracy needs an educated and informed citizenry to sustain itself, a healthy population is really key to a democracy having the ability to thrive. Civic engagement suffers when people don't have their basic needs met. We can see this happening today with certain segments of our society. But as Nora mentioned, this is a really circular, cyclical kind of thing. Civic participation is necessary for government to effectively serve the people. So we have to be positioned to do this. And in this sense, voting really is a public health issue. So how well does our system of government support engagement and our ability to give voice to our needs? In Colorado, we have a lot of laws in place that facilitate access to voting and participation in our policy development process, which is great. But our system's not perfect, and we know that not everyone has a truly equal opportunity to participate in our democracy. Too many individuals in our society are marginalized and their needs go unnoticed or unaddressed. In addition to ongoing assessment of ways that our laws can be strengthened to improve our governing structures and our public organizations, public entities such as ourselves, Colorado Health Institute, League of Women Voters, we have a really important role to play in helping to advocate for those that have difficulty advocating for themselves. So, I kind of pose this as, really a call to action to think of ourselves as ambassadors for, getting out into our constituencies and really illustrating both the importance of that participation and how it does affect how effectively government can respond to our needs. But also, and I'll start to get into this, providing education on the tools that are available to help voters access the ballot and really facilitate their voting experience. So as Nora mentioned, communities with more inclusive voting policies have more social cohesion, stronger community conditions, and better health. We see that research demonstrates a link between laws that support voter participation and better health outcomes. So it really is in our collective interest to work to continuously improve opportunities for civic engagement and to protect the right of all citizens to vote. As I mentioned, Colorado has a lot of laws in place to support voter participation. Things like all-mail voting, accessible voter service and polling centers for those that prefer to vote in person or may require some sort of in-person assistance. We have an extensive network of ballot drop boxes throughout the state, including a number of boxes on college campuses and tribal reservations. Efforts have been made in recent years to really boost the number of ballot boxes available on both campuses and in tribal communities. This is really important because currently in Colorado, 85% of ballots are received by Dropbox. So it is the most common way by far that voters do return their ballots. Another plus for our voting access in Colorado is that it's very easy to register to vote in our state. You can both register and update your registration online. So it is a simple process, really pretty accessible. And there's essentially no deadlines for new voters to register since Colorado allows registration through Election Day. So basically you can always register to vote in Colorado. So again, we've done a lot of the big structural things to facilitate access for all eligible voters in Colorado. And, we see the results of this in our election turnout. Joe had mentioned earlier that, Colorado is, our last general election in 2020, we were the state with the second highest voting participation rate at 76%, which is great. We also had the second highest voting participation rate in the US among young voters. But overall, when we're looking at that total number of 76%, which is good, on the flip side, it means that 24% of eligible voters did not participate in the last election. So how do we improve access and participation among non-voters? Well, the League believes that voter outreach and education are really important strategies here. The more voters are aware of the supports that we have in place in Colorado, the more likely they are to use them and to participate in the voting process. But we want to be realistic too and readily acknowledge that there are certain groups that face greater challenges to voting more so than others. And this is a problem. We need to be continuously looking at ways to ensure that everybody has meaningful and easy access to the voting process. Unfortunately, there are supports that exist to help individuals that face additional barriers to voting. But again, we need to make sure that voters know about them. So, organizations such as ourselves really can play an important education and outreach role here. Okay, so getting into the barrier side of things and thinking a little bit about, what populations may we be concerned about? Well, in particular, first-time voters are a group that, may face some additional challenges. Young voters in general, we've been seeing the rate of voter participation among young voters starting to increase over the years, which is fabulous, but we want to see that continue. There's a body of evidence that demonstrates that, the younger an eligible voter engages in the process, the greater the chances are that they become lifetime voters. So we really have an interest in terms of the health of our democracy over the long term to see that young voters are equipped and engaged in to participate in the voting process. Low-income voters, historically marginalized populations are also going to experience, some unique challenges to voting accessibility. And then elderly voters and those with disabilities or mobility issues are another group that have unique challenges that we need to be thinking about how we can continue to improve the process to facilitate their access. Okay, so thinking a little bit specifically about, some of the tools that are in place to help young voters engage in the process. We need to think about, some of the challenges that they might be facing. And really kind of key here is, failing to register, maybe not being aware that you need to register. So that's, again, another area where education and outreach can be very important in bringing these voters into the mix. Another challenge that young voters may face is possible ballot rejection due to signature verification issues. So in Colorado, young people can pre-register to vote at 16. And it's important that we really encourage them to do so, because when they become eligible to participate at 18, they're already set. So, the earlier we can get them registered and ready to go, the smoother things go when it comes time to participate in their first election. Also, Colorado election law requires that every public high school in the state designate a staff member to be trained in voter registration. So this person really can serve as a go-to to help students get registered to vote or get pre-registered to vote. And Colorado also treats colleges and universities in the state as a national voter registration agency. So when students are registering for classes, they're also asked if they want to register to vote. So again, there's a lot of channels for voters to get registered, but people need to know about them. They need to utilize them. Updating voter registration is also another issue that will be particularly important for young people. Young populations tend to be very mobile as they pursue education, as they start out in their careers. So, frequent updates to mailing addresses is something that's likely to really come into play for this population. Again, this is something that can be done online. People just need to, know that it's a very easy process and can be done in really just a few minutes. Another group that we want to make sure that we reach with this information is college students who are attending school out of state. Their residential address, their place of residence, doesn't change necessarily, but their mailing address will need to be updated so they can actually receive their ballot in a timely manner, at their campus address. So again, that updating function is extremely important for young people. I've talked already a lot about voter outreach, but I think we really can't emphasize that enough, because given the fact that we do have a lot of good structures and a good system in place in Colorado, a lot of this really comes down to voter mobilization and educating people on the tools that are available to help them vote. So voter outreach becomes really important for young people in particular, but really for all voters. And, when I'm talking about outreach, I'm thinking about outreach by the campaigns. It's in the interest of elected officials to engage young voters, but also outreach by civic organizations such as ourselves. We can provide a very important education function and mobilization function as well. Other things that have proved to be really effective in getting young people to vote are text reminders and commit to vote postcards or forms. Nora touched on this earlier. They can be effective for all segments of the population, different groups, but it's certainly a way to keep voting at the forefront of the minds of young people who may not otherwise be in the habit of regularly voting. I want to mention an important resource that I think is particularly important for young people to know about, and that is the Text to Cure system that's offered through the Secretary of State website. I believe there's going to be a link provided to take you to this site, but this is a system that Colorado voters can use through their mobile phones to submit additional information that might be necessary to resolve any problems that exist within their ballot. So this process is referred to curing, so hence the name Text to Cure. And missing or discrepant signatures are one of the key reasons that a ballot would be rejected and need to be cured. And again, this is really important for young people because first-time voters may not have a signature on file with the Secretary of State for verification purposes. So it's not necessarily that there's anything wrong with their ballot or their signature, but it's just difficult or not possible to verify it in some instances. So, making sure that young people know about the system and have access to it is a way to ensure that their ballot is ultimately counted. Okay, now turning to another group that may face some voting challenges, low-income populations, marginalized voters. Again, there are supports in place to help support these voters in their access to the ballot, but again, we need to make sure that they know about them. In addition to the ability to register and update registration online, which again is important for this population, all populations. Low-income individuals can also register to vote, as they may apply for TANF or food stamps. So again, there's a lot of channels to getting registered to vote in Colorado. There's a new 2024 law in Colorado that is intended to reach a really specific population, those involved in the criminal justice system. Colorado's county jails are required to provide at least 6 hours of in-person voting before Election Day, and jails are required to establish a location where incarcerated individuals can actually deposit their ballots. Voter education is really important here because there's a lot of individuals that are justice involved that automatically assume that they are not eligible to vote, which is often not the case. It's estimated that in the 2020 and 2022 elections, there were about 9,000 incarcerated individuals that did not vote. So education for this population and actually engaging them in the process is an opportunity to bring a lot more voters into the mix. In Colorado, it is illegal for individuals to cast a vote if they're incarcerated for a felony conviction, but individuals who have served their sentence, are on parole or probation, or those awaiting trial or serving a misdemeanor sentence are eligible to vote. And then another tool that I want to mention that can be helpful for low-income populations is the voting center siting tool. This is a tool that local governments in Colorado are required to use. It's basically a tool that provides really a wealth of information to help local officials determine how close people are to drop boxes and where more are needed. But it also allows for demographic breakdown, so we can kind of sort by population, and it allows public officials and members of the public to examine access and suggest prospective locations for new drop boxes.
Okay, I'm sorry, I'm really apologize for interrupting, but we are down to a few minutes left here, and we do have questions. Could we pause now for questions, and then if there's time, we can finish up, and otherwise we could post your slides to our website as well.
Absolutely. And Joe, if I could just switch to the last slide, I just want to give people a quick opportunity to see some of the election deadlines that it's really important that we abide by, just so everyone's got those kind of front and center on their mind. And with that, I will turn it back to you.
All right, thanks so much. I'm gonna add Nora back on screen here as well. And we do have a question from John Daly. So John, go ahead and first of all, great to hear from you, and go ahead and ask your question. John is a reporter with Colorado Public Radio. If this is the John Daly I'm thinking of.
Yes, it is. Thanks, Joe. Yeah, I was struck by one of the stats that you had, Nora, about healthcare workers, and I think you said, well, it's the largest workforce, but they are 12 to 23% less likely to vote. I don't think I'd heard that stat before. I was surprised by that. Do you have any sense of why that is?
Yeah, so thanks for that question, John. I think it's important to kind of recognize that healthcare professionals, one, work very demanding jobs with, schedules that are jammed packed. And sometimes folks work 12-hour shifts. And the listed reason for not voting in the current population survey, which is what they used for the study for healthcare workers, was the same as the general population. So not being registered or not understanding the rules and systems and processes to get their ballot in on time to be counted on election day. And so it's really important that we realize that our organizations can do a lot more to build a culture where we're all participating, create systems and structures so that we're, providing voter registration through our HR practices, through our emails out to our members, that we're sending key election dates like the League of Women Voters shared on that last slide, and really getting that out in front of people. And I also think that there's more anecdotally, I think we oftentimes put ourselves secondary. So when folks think about showing up to vote, they often think, oh, everybody else is probably going to vote. Why do I need to show up? And I actually talked to a nurse out in rural Virginia earlier this year who said, I'm part of that stat. I didn't vote. I didn't know that everybody else wasn't voting. I thought everyone else was going to show up for me. But you bet it, I'm going to show up on the elections I'm eligible to this year. So I think it's part of building our culture. I think it's also just part of making sure that we know that we have to be registered and that there are times polls close. So yeah.
All right. Who has our next question? And if you'd like, you can, if you don't want to come off mute, oh, here we go. Kelly, I am unmuted you. Please go ahead and ask your question.
Thanks. Hi, my name's Kelly Steinbach Tracy, and I work at the Public Health Institute at Denver Health. I appreciate this so much today. Thank you. It's fascinating and also at the same time not super surprising. One of the things that struck me is that I'm curious about, as we're doing voter outreach, appealing to that sense of that emotional sense that your vote matters, and I wonder if it's actually some of that sense that is tied to health, because we know from other research around, economic opportunity is also linked to, health outcomes. And I think it's intertwined, right? If my society has lowered barriers for me to vote, then therefore you can infer your vote matters. And if your society has increased barriers to vote, you may infer that it doesn't matter as much. But in addition to the logistics of voting, I'm curious about that appeal to that emotional sense that your vote really matters, which may actually be what's tied to health. I'm curious just your thoughts on it.
Yeah, I mean, absolutely, Kelly. That's actually one of the reasons why with the Thrive Through Civic Health We Will Vote initiative, we launched a storytelling component to have health professionals sharing, why voting is critical to the health of their communities. And I was part of a session yesterday with County Health Rankings and Roadmaps talking just about the power of storytelling and narrative to really shift the dominant narratives around, individual responsibility and apathy that can lead to more people participating. So I definitely think that's part of it.
Andrea, you want to add something there?
I think the thing that I would add is something that I touched on a little bit in my remarks is, kind of building building into the mindset of people that their vote matters and that participation is just so important from a really early age. Kind of thinking back to that research that does demonstrate that, if you can engage young voters from really from the beginning, you're much more likely to have a lifelong voter. So I think that's where things like, civics education, outreach by, nonprofit organizations, stakeholder groups, to really reach those populations, get young people involved early on. So we hopefully are ultimately building lifelong voters.
Yeah, one of the great things about Colorado and mail voting is you can do this at home. So when my wife and I vote, we sit down at our kitchen table with the kids and they're pretty interested in it. One more question here, and then I will do a bit of a wrap up. You share the source for the stat that healthcare workers are less likely to vote, and I think Nora might have just popped that into the chat. We do have one more question, but I realize people are some people will be rushing off to 9 o'clock meetings. Want to let you know later today the video from this and presentations and other sources will be on our website, and everybody who registered will get an email with all these links. With that, let's go to Jeannie Ayers for our last question.
My question is just, what can we do to support the environment that makes it easy for people to vote? And I think in Colorado, you've named And Andrea outlined all these great initiatives, and those things go hand in hand. And I'm just wondering if beyond individually voting, we can, what thoughts do you have about how we can work together to make it more accessible for the groups that Andrea mentioned that were having more challenges?
One thing I would suggest is when we think about, nonprofit organizations, such as Colorado Health Institute, League of Women Voters, other civic organizations, when we think about our own membership and constituencies, I think, trying to make inroads into and connect with, the groups that we know that, do experience some additional barriers. So, that messaging reaches them directly. But I also think, there's a learning opportunity there, because while we do have a lot of great tools in place, there's likely to be a lot of unique barriers that people are struggling with that we may not realize that, maybe we haven't addressed yet. So I think hearing directly from the populations that are impacted, that helps us in our advocacy, because, not only can we be an ally and bring them into the mix in, our advocacy efforts overall, so, they can give voice to their concerns, but we can advocate alongside them if we understand what those barriers are. If policymakers don't understand the nature of the problem and how things are actually playing out on the ground, they can't solve it. So I think hearing directly from the populations that are impacted always gives us additional insights into where more improvements are needed.
All right, thanks so much. That's we're at time. Thank you everyone for sharing your morning with us on this really important topic. Much more from CHI coming this fall, and go forth and vote. So take care, everyone.